Ladies and gentlemen, welcome back to the Jibawi Brothers podcast with Access Healthcare. My name is Dr. AJ. On the other side, I have my brother, Dr. MJ. You all know him. What's up, MJ? How you doing? High five, buddy. Social distancing. Whoop.
6 feet, baby.
6 feet, my man. So, welcome to episode 2, titled Quarantinified. Are you quarantined? Are you practicing social distancing? Any lifestyle modifications? That is the topic for today. MJ, how you been, buddy? Tell me a little bit about yourself, man.
Man, I've been great, washing my hands, wearing my mask, and staying away.
Earlier today, I went to Publix and I saw some patients wearing double gloves, which I thought was pretty interesting. They were double gloves. Some people were wearing masks, some people were not. It was a little scary, but I think that we need to kind of educate our patients today on what the importance of wearing your mask, washing your hands, and protecting yourselves. So, a little bit about today, being quarantined. So, I wanted to emphasize to our patients that the most important thing that we need to understand is just in case you do get exposed to COVID-19, you need to have a plan in place.
Prepare yourself.
Yeah, prepare yourself. Yeah, absolutely. And patients need to understand that if they are being quarantined, they need to make sure that they're ready for a 7 to 14 day isolation.
Because everybody feels like they're not going to be infected, and that's why this thing is spreading so fast.
Well, that's the problem. A lot of people think that they're immune to the virus or bulletproof. I would say it doesn't really work like that. So a few tips for my patients. Have a plan in place. First thing I would recommend is food. Make sure you have at least a 2-week supply of food. Now, if the food will expire.
What if you got chicken? Yeah, I mean,
I know chicken. I know
can't keep chicken 14 days. I mean,
you
I don't know about you,
every
but
day.
I'm not eating chicken after 14 days.
I know. I don't blame you. And that's why I bought like powdered milk. I bought like some fruit cans and some frozen vegetables. Those are perishable items that you need to understand. Another thing is, what if you develop a fever? Do you have medications to control your fever? So what type of medications can patients buy over the counter, Dr. MJ?
You can do Tylenol or any of the NSAIDs, but you got to make sure you check with your primary care before you take either one. You know, if you have any kidney problems or if you have history of bleed, you can't take NSAIDs, right? So use Tylenol. If you have liver issues, that's a whole different topic. Make sure you communicate that with the primary care, but you can use either one if you don't have any medical conditions.
Okay. I also wanted to emphasize, I've been telling a lot of my patients to maybe get a supply of latex gloves, like hand sanitizers, wipes, etc., to make sure that they have enough on hand just in case they do need to be quarantined and isolated.
But just don't buy 30 packs of them. I mean, leave some for everyone else. And then I feel like that's a whole different topic. But if you are going to the grocery store and you need 14 days, that's fine. But if you're living alone or living with one other person, you don't need 30 packs, okay? Because there's other people. I had a patient that went to Walmart and he had a bus and he only gets one ride. And when he got to Walmart, there was nothing there. It was really sad. It broke my heart. So we really have to think of everyone else during this time.
Absolutely. And that's why I've also been contacting my patients to make sure that they have also enough prescription medications. You know, we have a lot of our patients who are hypertensive, diabetics, thyroid issues, cholesterol issues. Make sure you have at least a 2 or 3 week supply of your prescription medications and your non-prescription medications. So, Dr. MJ, I don't know if have you had any patients that all been positive for COVID-19?
I have not physically seen them, but I have some patients that ended up going to the emergency room, and I did find out that they had COVID, and that's kind of the topic today. What do you do in that situation when I do have
absolutely,
it?
Absolutely. If you are isolated or if you are diagnosed with COVID-19 and you are quarantined, I do advise you to make sure that if you do need help, reach out to family members, reach out to your doctor, reach out to friends. Even though they cannot physically see you and come inside your house, maybe they can leave you groceries in front of your doorstep. You know, another situation that I had with a patient of mine who was on quarantine actually because of possible exposure was bathroom use. Yeah, so we are advising our patients to, if you are quarantined and isolated, try to avoid using bathrooms with multiple people in your household. Stick to the one bathroom and make sure that they use other bathrooms. And if you can't, well, make sure you wipe after yourself and clean it up.
Question for you, AJ. When we say quarantine, now is that person quarantined mean that they have it or they just had symptoms and they got quarantined? Do you understand what I'm saying?
Well, I mean, if the patient has been exposed, you want to be quarantined and isolated,
Exactly.
right? That's the most important thing. Now, if you haven't had any exposure, you don't necessarily need to be quarantined, but try to isolate yourself and practice social distancing. Is pretty much what the goals are.
So some important things that patients need to understand is one,
Yeah.
if you are infected, you've been tested and you are positive, a few things that you need to understand. One, stay at home. Two, if you are at home, make sure you stay in your room.
Yep.
It's very hard for some patients that don't have caregivers and stuff, but
Yeah,
if you,
how do you expect these patients to stay all by themselves?
that's what we're dealing with right now. This is the toughest part for us right now is that, but if they are staying at home, make sure that, no visitors.
Okay.
This is not time to socialize, especially if you're infected, because that person that's going to come visit you is going to pass it on to everybody
But
else.
what if you have family members that live with you?
Then you isolate yourself to that one room, okay? Disinfect everything, use one bathroom, and make sure you follow those rules, okay? One toothbrush, one towel. Don't reuse a towel. If I have COVID-19, I shower, do not leave that towel. Make sure you wash everything. Disinfect everything.
Yep.
The whole point of this, I know it's very tough on all of us to continue to do this. Some people are losing their job. Some people are, working at home with multiple kids, homeschooled. It's very hard to control all of that during this time. But the sooner we learn how to practice good hygiene, the sooner this pandemic is over, the sooner we can get back to regular life.
I think that we need to talk about the boredom. Boredom at home. I mean, how to keep your spirits up, how to, avoid being bored. So what I've been recommending to a lot of my patients is, if you are trying to control your anxiety about this situation, a very important aspect is understanding this illness. The more you know about this virus, the less anxiety you'll have, the more you are prepared. Don't change your daily routine much. Exercise regularly, eat healthy. Don't watch too much TV.
Learn a new language, learn a new hobby. There's so, one thing that I never understood is people always wish they were at home, wish they had more time. Guys, you have more time now. This is your time to learn something new.
I completely agree. Utilize this time with family members. If you are healthy and you not have been exposed to this, utilize it. I think a lot of patients, maybe depending on their previous lifestyle, this is going to be a little bit harder. I have a lot of my patients that have gained weight through this pandemic. They've become, maybe I would say, a little bit more depressed, which is very unfortunate. But the positive message that I'm trying to relay to our patients is that if you need to have lifestyle modifications in order to get through this crisis in this pandemic. If you lost your job, look for another job. Work online, work from home. Whatever it takes for you to feed your family, whatever it takes for you to be stronger. And this is why I like to implement exercise regularly and lifestyle changes, because endorphin release and, it just makes you happier to be healthy and exercise, of course.
Stay positive.
Stay positive.
Don't focus on what has changed. Focus on what hasn't changed. And what's that we are here for you. Access Health is here for you.
Yep.
We want to help you in every way possible.
Well, I think this is going to wrap it up for Quarantinified. MJ, do you have any last remarks before we get out of here, my man?
We were talking about exercise. I think me and you should do an exercise video for the patients.
We will.
If you guys are excited about that, please put that in the comments. Let us know. And we'll be more than happy to do an exercise class for you guys.
That'll be fun. That'll be a lot of fun. All right, let's end it with our message. You know what it is.
Ain't no mountain high.
Ain't no valley low.
Ain't no river wide enough, baby.
If you need me, call me.
Where do you call AJ?
727-777-5522. Thank you so much, and God bless.
Love you, brother.
Love you.